cardiologist. We're now joined by Dr. Ashok Seth, Chairman Fortis Escorts Heart Institute. Thank you so much, Dr. Seth, for joining us. And this is very worrying. Also, the fact that it's affecting young people as well, and even those who've had mild illnesses need to watch out for any sort of impact COVID has had on their heart.
Yes, you're absolutely right. In fact, very early on in the COVID start of the COVID pandemic, reports from Italy had already warned us that heart problems could be a very major factor leading to death of many patients. And in fact, I even wrote up a piece in the National Daily saying COVID is not just a lung disease, it's also a heart disease. This was nearly 6 months ago. Now, what we've realized is that while COVID can affect heart patients in 3 manners, it's not just the serious patients who are very sick with COVID-19 who get heart problems. We know that in those, nearly 40% of the patients would get heart problems, and it is the cause of death in 40% of the COVID deaths. But what is important to understand is that even those recovering at home, those who had mild illnesses, those who said, "Arey, mujhe to pata bhi nahi chala, I had COVID, I just had a bit of flu-like symptoms, and now I'm fine and well."
Yes.
Even those can actually get affected by heart ailments. And there are 3 types of heart disease that anybody can present with. One is that COVID itself leads to increase in blood clotting. An increase in blood clotting can lead directly to heart attacks, can also lead to lung, what we call pulmonary embolism, can also lead to brain strokes. The second aspect, which you just said yourself, is the inflammation of the heart muscle as a result of infection with COVID. And that has a longer term, should we say, disease process. In fact, you yourself mentioned a study where nearly 70% of the patients who recovered from even mild COVID were found to have inflammations on an MRI scan. I just want to warn people that it's not to worry about. It is inflammation which has been seen in the heart muscle, which may not have any sequelae or may on the long term at 6 months and 9 months, and that still needs to be studied. But what we definitely tell patients is that after recovery from COVID, don't be careless out there. ये सोचो कि मैं recover कर गया हूँ, अब मैं तो बिल्कुल freedom हो गई है, मैं कुछ भी कर सकता हूँ. And many people I've known get back to even jogging and running within a month of COVID, saying मैं तो पहले jog करता था, अब मैं ठीक हो गया, let me go for a jog, or heavy weight lifting. Do not ignore your symptoms. If there's breathlessness, if there's palpitations, it is important to actually see a doctor. And for all COVID patients who have the facilities to have a checkup, we always do an echocardiogram and an ECG to make sure that those 2 important parameters of the heart are functioning safely.